Hi everyone, welcome to Raaonline. I am Dr. Ashok, Assistant Professor of Microbiology. Now moving on to the diagnosis. So before going to the diagnosis, I just want to talk about the clinical future. So clinical future, here the patient is going to have the futures like delirium, dementia, and the futures of Parkinsonism and Alzheimer. So those kind of things are going to be there. So here it's mainly going to be a neurodegenerative disorder where the patient is going to have these kind of symptom. So once the patient is going to have this kind of symptom, like we are going to go for the diagnosis. So prion diagnosis is quite a bit difficult one, like being a non-infectious particle, we will not be able to demonstrate the antigen or antibody. So we have certain specialized tests to detect this particular infection, and the sensitive and specific test which we use for diagnosis of prion infection is going to be the conformation dependent immunoassay, where like we will be measuring the particular PRPSC, so which is the infective form of that particular protein. So here the normal protein gets converted into the abnormal protein. So that abnormal protein like we are going to measure by using a technique called conformation dependent immunoassay. So it's one of the tests which is going to be very sensitive and very specific for detection and measurement of PRPSC. And the second thing is going to be the resting EEG. So here like we are going to measure the EEG like in the particular patients with who is going to suffer from the prion infection, there is going to be something called high voltage triphasic sharp discharge. So whenever like we are going to have a particular EEG which is going to show an high voltage triphasic sharp discharge, and the patient is going to have a neurodegenerative type of illness, so we can suspect prion infection. And the third thing is going to be the sequencing. So sequencing again like it is very sensitive. So here like we are going to look for prion gene mutation. So in case of anything like a familial Creutzfeldt-Jakob disease, it will be very useful where we can detect the prion gene mutation. So here like we will be looking for the PRNP gene, and after looking for the gene like we will be detecting the mutation. So when we are going to detect the mutation, it's going to tell whether the patient is going to have anything like familial Creutzfeldt-Jakob disease. So this is about the sequencing, like which is a very good or very sensitive test for diagnosing prion infection. And fourth thing is going to be our biopsy. So most of the time like we are going to do the biopsy like after the death. So here most of the time is going to be the postmortem examination of brain tissue, where we are going to do a histopathological study. And in the histopathological study like we will be looking for the changes like spongiform changes. So whenever like there is going to be an histopathological section which is going to have and future like spongiform changes, like it is going to denote that there is going to be a spongiform encephalopathy. So like it's going to tell if the patient is going to have an prion infection or not. And there is also like a special histochemical stain which we can use for studying the particular infection. So we can use stain like toluidine blue stain, like where we will be able to see the protein aggregate which is formed by the particular prion. And to a certain extent like electron microscopy will also be very much useful. So here that particular electron microscopy can show us the presence of the prion fibrils in the particular sections.